So for headache and migraine sufferers, there is often a vital element in treatment that is often missed, which means that as you're being treated, you often see little to no results happening, or you see changes happening for a short period of time, but then those changes stop and then you go back to your original state. So basically, you're not seeing the changes that you want to happen at all. So that's what we're talking about today. What is this vital element and what can you do to treat it? Hi, I'm Dr. Beth, an osteopath here at Melbourne Headache Solutions. So for headache and migraine sufferers, very commonly, we are put on medications that honestly we have no idea what they're doing to us, or alternatively, you're getting manual therapy to your body and it makes limited changes. But again, you're not seeing those long-term results that you're after. So what is this vital element that's missing in treatment that hinders you from getting those long-term results? What are you missing? It's this thing called brainstem sensitization. So what is your brainstem and how does it become sensitized? So your brainstem is a part of your brain, and essentially it's a bit of a relay center for information that's coming up. And it also houses or originates quite a few things. But importantly for headache and migraine sufferers, it houses the origins of your cranial nerves. And your cranial nerves are such things as your optic nerve, so it controls your sight, and things like your spinal accessory nerve, so it controls the muscles around your traps, so it's going to make your traps and your shoulders really, really tight. It also houses your balance center as well as your nausea center and your vomit center. So when it gets upset, you get all of the associated features of a migraine. So, as I said, things like dizziness, nausea, vomiting, light, sound and smell sensitivity. So your brainstem is vitally responsible for all those associated features. But as I said, it's a bit of a relay center as well. So all of the nerves that innervate your face and your head, they also feed into the brainstem. So when it becomes sensitized, and sensitized basically just means hyperexcitable, so it's too excited, it's responsible for the pain you feel in your face and your head of a headache and a migraine. So that's basically what your brainstem is. So if you don't treat this brainstem sensitization, nothing changes, okay? So that is this vital element. That is what you have to change to get those long-term results that you are after in regards to your headache and migraine pain, okay? So what happens when you take your headache and migraine medication? So for things like Maxol, Immigrant, preventative medications and those sorts of things, they actually only work on a proportion of that brainstem sensitization, because many things happen when your brainstem is sensitized. So you get things like pro-inflammatory mediators, so inflammation. You get blood vessels that constrict and dilate, so opening and closing. So those are the things that those medications work on. They work on bits and pieces, but they don't work on the sensitization as a whole. So they're not getting the whole puzzle. They're only getting little bits and pieces of it. So that's why those medications work on some people and not others. And they work sometimes for short periods, but then they stop working because your body gets used to them. Because again, they're not working on the whole puzzle, they're only working on a little piece of it. So it's not the most effective thing that you can do, and they only work temporarily because you've got to take these things consistently or only as you have symptoms. Other people, as I said, they get manual therapy for their body. But when you're getting manual therapy for your body, it's not addressing that brainstem sensitization. So you're left with this feeling like you're a headache and a migraine waiting to happen 24/7 with both scenarios, because nothing's really addressing that underlying cause, which research tells us is the problem. So what are you going to do about it? How do you take yourself from feeling like a headache and a migraine waiting to happen 24/7 to feeling amazing and normal and doing all the activities that you want to be doing? Well, there is one manual therapy technique, one, that has been researched and designed specifically for headache and migraine sufferers, that has been shown to decrease that brainstem sensitization in a natural way through manual therapy. And it's called the Watson headache approach. So it's using manual therapy to decrease that brainstem sensitization as a whole. It doesn't target individual bits like what that medication does. It does it as a whole, so that you get the whole thing, and it brings you down to a more normal threshold. So as I said, you're not that headache and migraine waiting to happen all the time, okay? So that's what we're after. We're after those long-term results so that you don't constantly feel like you're on that verge of a migraine or on the verge of a headache, because that's no way to live. So if you think that you've been missing this vital element and you think that you can get some results or that you can do better than the current state that you're in, comment headache or migraine down below in the comments section, and we'll send you a quick first step to see and determine whether you are susceptible to this brainstem sensitization, and get you started on your first step, on your first pathway to get you towards those long-term results that you deserve. Thanks guys, I'll catch you next time.